Hello, my name is Timothy Manning. I'm your student nurse today, and I'm here to explain to you about Albuterol that you were prescribed by your doctor. I also made a pamphlet for you, bought a pamphlet for you to read along with if you have any questions. So to start off, what is Albuterol? Albuterol is a bronchodilator that is prescribed for individuals that may have COPD, asthma, emphysema, or like any kind of upper respiratory diseases. It is a beta 2 adrenergic receptor antagonist, and it is prescribed to open up the airways in the event that you might have a fit, like you might become short of breath. All right. Albuterol works in the body by opening constricted airways. So, for instance, with COPD patients or asthma patients that are experiencing severe shortness of breath, the airways are constricted, so no air can pass through this hole right here. When you take your inhaler or use it, it opens up your airways, allowing air to flow through, and then that feeling of shortness of breath tends to go away. It also helps you breathe better, like I said, by opening your airways if they are constricted. And if you do have mucus, it'll open you up. That way you'll breathe and your body will try to get that mucus up out of you. This medication is used during like first line. It's a rescue inhaler essentially. So like when you start experiencing these symptoms, you use it, and it's for a fast response, short acting. Not a long-term kind of maintenance med, but it's first response for severe shortness of breath. Albuterol is prescribed for those individuals who have asthma, whether it's childhood or later in life, or bronchitis, which is inflammation of the bronchioles, which causes, again, that narrowing of the bronchi. COPD or emphysema. Some of the adverse effects and side effects that come with taking albuterol can be angina, which is chest pain, arrhythmias, which is irregular heartbeats, where there can be fast heartbeats or just the rhythm of the heart may flutter a little bit. It also can cause hoarseness. It comes with headaches. It also may make you feel anxious or nervous, but that's also a side effect from the arrhythmias you may have, or like the tachycardia feeling you have. You may also have palpitations, where it feels like your chest is beating out, like your heart is beating out of your chest. But that's a common side effect with taking this medication. You also experience like a faster heart rate after taking this medication. If you experience these symptoms and for an extended amount of time, you should call your provider. Interactions with this medication or contraindications with this medication. If you have a sensitivity to this medication, you need to let your provider know. This medication in particular shouldn't be taken with beta blockers, MAO inhibitors, digoxin, or you should also try to stay away from caffeine, because caffeine can precipitate some feelings of anxiety or nervousness, which can also cause you to feel shortness of breath. Now, on the last part of this pamphlet, where it says how to take, it's got steps to show you. On the first part, the first step, you'll open the cap on the inhaler. You'll open the cap on the inhaler. And so, you'll take it and you'll shake it. I don't have a spacer here with me, but you will put this in at the back end of the spacer. And once this is connected to your spacer, you will press down. You will put your lips on the other end of the spacer. You will press down and inhale for 10 seconds. You'll inhale a slow, deep breath for 10 seconds. And then relax. And you can repeat that process if you need to, or however many times it's prescribed. Some orders will say 1 puff every 4 hours. Others may say 2. But if you do need to get another puff, wait 30 seconds in between each puff. And then afterwards, so you don't get hoarse or it doesn't irritate your throat, you make sure you stay hydrated with this medication as well. And at the bottom, you can see the references is where we got our information from. And if you have any other questions, you can always call us back, or you can always contact the provider.